of your TOS symptoms. For these special tests, I may be required to place my hands on around your neck area, around your head area, shoulders, and possibly down your arm, around your wrist, and on your hand area. For this special test, the purpose is, as I mentioned, to assess the severity of your TOS symptoms, but we may possibly provoke some discomfort while we're performing any of these special tests. So if you experience discomfort at any time, please let me know and we'll stop or modify accordingly. But hopefully we'll be able to gain information about your condition as well as develop a treatment plan for you. Do you have any questions about what we're going to be doing today? Do I have permission to continue? Perfect. I will get you to go ahead and just prop yourself up there on the table. Seated, I should say. Yep, seated. Okay, clear directions is necessary because you never know what people are going to do. Oh, actually, can you get that off, please? Thank you. Patient is either going to be seated or standing. So it's just good to get into the habit of whenever you have your patient seated, have their feet on the floor. Can you maybe come forward just so your feet are stable on the floor? Thank you. For this special test, not mandatory, but just get into the habit of it with all of your special tests to make sure your patient is secure on the floor. All right, so James, I'm going to get you to, when I say so, I'm going to get you to go ahead and elevate your arms to here and here, and then we're going to get you to rapidly open and close your hands 15 times, okay? So I'll get you to go ahead and arms up to that position and go ahead, rapidly open and close. Let me know if you notice any sensations, numbness and tingling. Okay, awesome. And you can relax now. So with Alicia, it's actually crazy. Her arm goes like white. So if you can, it would be best to actually have your patient in like a t-shirt or something where you can actually see their skin to see if there's going to be a color change happening there as well too. All right, so that was a negative because he didn't report any sensations into his arms, but a positive would be if he were to report feeling of fatigue, cramping, or tingling during the test, and that would be a positive for vascular insufficiency related to TOS. Now, to indicate this special test, if your patient complains of, I get numbness and tingling into my hands in certain positions, or sometimes my fingers go really, really cold when I move my arms, anything along those lines. Altered sensation with the arms, let's go ahead and do proactive elevation just to see if TOS is suspected. Tissue being stressed is the neurovascular bundle of the upper extremities, aka the brachial plexus. Questions about that one? All right. So this is a variation of RUSE. So RUSE is also a special test that tests for all sites of compression. Okay, the only difference is we do RUSE for 3 full minutes. Everybody's gonna test positive after 3 minutes. Yeah. Okay, questions about provocative elevation? Okay. So we've got ADSINS, which is our test for anterior scalene. See, I underlined it for you. So what we're going to be doing is this is assessing to see if there is an anterior scalene compression happening to our brachial plexus. All right, James, so we're going to be moving on to another special test. This one, again, is assessing to see the severity of your TOS symptoms. For the special test, I will have to place my hand on your shoulder as well as around your wrist. We're going to be bringing you into a certain position and then getting you to move your head. Purpose of this, as I mentioned, was to assess the severity of your TOS, but there is a chance we might create some discomfort. If you experience any discomfort or change in sensations, please let me know, and we'll modify our assessment accordingly. But hopefully we'll be able to get information regarding your overall condition and how to develop an appropriate treatment plan for you. Do you have any questions about what we're going to be doing today? Austin, do I have your permission to continue with this? Great. So we would normally assess the unaffected side first, right? So I've assessed the unaffected side first. Okay, we're going to move on to the affected side. All right, so for this special test, you are going to locate your patient's radial pulse, okay? Once you've located their radial pulse, you're going to, okay. So we start with his head turned towards me. I'll get you to go ahead and turn your head. And then to initiate the test, I'm going to traction as well as externally rotate his shoulder, bringing it back into extension. And I'm going to get him to also bring his head back into extension towards this side. Good. And then I'm going to get him to take a nice big breath in and hold it for 30 seconds. Okay. Well, your pulse did disappear, so that is a positive. Good, and relax. Good, and is
Your pulse returning?
There's his pulse. Okay, his pulse is back. Okay, so that was actually a positive. So a positive is a disappearance of his radial pulse. Yes, a positive is his radial pulse disappears, and we've got arterial insufficiency related to TOS. Okay, again, same indication is numbness and tingling into the arms, complaining about pallor or cold hands. And tissues being stressed is we've got our brachial plexus and subclavian artery only, not the subclavian vein. Okay, any questions about Adson's anterior scaling test? Okay, and then we've got Travell's variation. So I like to say the difference between Travell's and Adson's is for anterior scalene. Travell's, their head travels away. So same thing, except their head is turning that way instead of towards. They're turning away. All right, I'll get you to come forward so your feet are on the floor. All right, all the same stuff related to that last one. Do I have your consent to continue? Great. It's all exactly the same. All right, so once again, do the unaffected side first. I'm gonna locate this radial pulse of his. Good. Okay, I found his radial pulse. And then I will get you to go ahead and turn your head away from me. And then when I say so, I'm gonna get you to add an element of extension, okay? All right, I'm gonna externally rotate traction and extend his shoulder. And go ahead and extend backwards as well with your head. And then big breath in. And hold it. His pulse is gone again. And let it go. And his pulse is back. Good. All right, so that was also a positive. I'm sorry. Don't know what to tell you. Because his radial pulse did disappear. So that's technically positive for TOS. Do you ever get TOS symptoms, like ever? Okay, well, at least you know how to do the special test. Right? So biggest one is their head travels away from the side being tested. And make sure that for these ones, you do get them to take a deep breath in and hold it. That furthers the compression in the area. All right, any questions about this one? Great. And then lastly, we got our scalene cramp or scalene relief test. Okay, so James, we got our final special test we are going to perform today. So this special test, I actually do not have to place my hands on you at all. What's going to happen is I'm going to just guide you through a series of motions to perform with your neck area, just to see if we elicit a certain discomfort response. So as I mentioned, there is a chance that we might possibly provoke some discomfort with this special test, so please let me know if you experience any discomfort and we can modify accordingly. But this is to assess the severity of your scalenes involved in your TOS symptoms, but also will help me develop a treatment plan for you as well. Do you have any questions about what we're going to be doing? Do I have permission to continue? Perfect. Okay, always testing the unaffected side first, just to establish a baseline. We've already done that, so we're going to move on to the affected side. So, James, I'm going to get you to go ahead and turn your head this way, and then I'm going to get you to tuck your chin downwards like you're trying to insert your chin into this hollow of your neck. Good. And back off. Did you notice any pain or discomfort with that one? No. Okay, so essentially, if that was a positive, he would have felt a cramp in the scalenes when he did that. Hence the name, scalene cramp test. Okay. Very nice. So patient is asked to rotate their head to the affected side and pull the chin downwards into the hollow created by the clavicle. So again, same indication. Patient complains of numbness tingling down into the hands, cold hands, etc., etc. They will complain of specifically a trigger point, but also an increase in radicular signs is also a positive, but it's more specifically that cramp feeling when they actually squeeze their scalenes. And again, the tissues being stressed is the neurovascular bundle of the brachial plexus plus the scalenes. So these special tests are probably the easier ones that you will encounter. All right, any questions about that? Yes, Kevin.
So the first test, you have the elevated provocative, is test for both compression side.
Yep.
How come that one is negative, but when you get into the specific one, then you get positive?
Good question. It's probably because it's not actually TOS for him. Do you see how big his muscles are? They're probably getting in the way. Yeah, the additional and excess tissue taking up more space than it normally would, especially down into the arms and chest. Do you see those arms? Right, so that's my guess, because going into this position will technically strap down all the pathways, but this one is all reliant on the tightness in his arm.
But if they actually have TOS, then the first test would be positive, and then you do the breakdown test to identify which location.
You got it. You got it.
But if in his case, then with his test being positive, you wouldn't say that he has TOS.
That would be your differential diagnosis.
What's the differential?
So differential diagnosis is because we're not allowed to have full-on diagnose, right? We're allowed to name our suspicions, and we're encouraged to list a few of them. The first one is going to be our, I actually think this is the problem.